Let's say there is one drug that has been discovered recently for curing HIV, and the study that analyzed the efficacy and safety of this drug concluded that this drug is effective in curing HIV. So this is positive result, right? So this new drug is effective in curing HIV. But no study is 100% perfect, right? No study is 100% right. Even this study is claiming that it cures HIV. There is like 4%, 5% chance that this has happened just by random chance, right? They keep 5% cutoff. They accept that about 4% of the time it can happen just by random chance, but 95% of the time it won't. That's why this study has been accepted and published, right? So that 5% or 4%, whatever is the p-value, that is the type 1 error. What is type 1 error? Type 1 error means that you rejected null hypothesis and you concluded that this drug works. But that rejection that you did might be erroneous, right? You rejected null hypothesis that this drug does not cure HIV and you concluded that this drug works. So what is the percentage of type 1 error? If it is like less than 5%, then statisticians will agree to let publish this, because we have to allow 5% error. If you go by 100%, it is very difficult to conduct a study. You will require very large sample size. So to make experiment feasible, to do in low cost, so that even less sample size is acceptable for conducting the study, they say that allow 5% error. So in this study there can be 5% chance that this has just occurred by chance, but 95% of the time it is sure that this has not occurred by chance. There is true association that this drug is curing HIV, right? Now what is type 2 error? So we talked type 1 error. What is type 2 error? So type 2 error means like we accepted null hypothesis, but it was false. You should not have accepted null hypothesis, but you accepted null hypothesis, and you are saying that these drugs does not cure HIV, but in fact it might be curing, right? So let's suppose the type 2 error is 10%. Type 2 error is represented by beta and type 1 by alpha. So let's suppose beta is 10%. So there is 10% chance that there is 10% error. This can happen 10% of the time that you falsely accepted null hypothesis. You should not have accepted null hypothesis, right? This error has occurred by accepting the null hypothesis, right? And if you subtract this beta from 1, it gives the power of the study. So 1 minus type 2 error is the power of the study. So the error that you committed by accepting null hypothesis and concluding that this drug does not work in curing HIV, that is the beta, that is the type 2 error. Let's suppose this is 20%, so the power of the study is 80%. Right? So to decrease this error, to decrease the beta error, you have to increase sample size. As much there is more sample, your beta error will decrease and power of the study will increase. I will continue this discussion in another part of the video.